Hi everybody, I'm Amy and I'm 55 years old from Las Vegas. And I want to tell you a little bit about my experience here in Tijuana and my surgery. I'm so excited. I had my surgery just 2 days ago and I feel great. And when I decided to make my decision, it was based on some friends that I'd spoke to who are nurses who had already been down and had surgery with Dr. Cervantes. And I figured if a nurse makes this recommendation, who better knows hospitals and the way they should operate? And so I was sold. And I made a contact and I received a call from Eduardo shortly afterwards, who asked me some questions. I had some questions for him, and he really put me at ease. I also, fortunately, I received a call from Dr. Cervantes as well, and I asked him a couple of questions, and I can tell you both these guys are so knowledgeable and they're so good at what they do that I had no worries coming down to Tijuana and having my gastric sleeve surgery here. About 2 days before I left Las Vegas, I was at work and I received a phone call from Omar, who introduced me as my chauffeur. And he told me that he would be picking me up at the airport when I got into San Diego. He told me what color his vehicle was and that he would be there. And I received another phone call from him that very day that I came down, again asking me if I was at the airport, if my plane had arrived on time, and he was right there outside where he said he would be, and he picked up my friend, my caretaker, and myself, and there was another patient and her husband as well in the van, and took us to the hospital. As soon as we got to the hospital, we were checked in immediately. We waited a few minutes in a waiting room while everyone that was having surgery that day had blood work done. They want to make sure that we're well and ready for our surgery. And then we were taken up to the second floor where my room was. And right away when we got in, we were told like where the towels were, where everything was that we needed. There were some folks that helped my caregiver, her name is Jill, get a couch so that she would be comfortable for this stay. And somebody said, hey, let's get this party started. And I put on my hospital gown. And from there, people came in. I was put on an IV immediately to make sure that I would be hydrated. And then someone else came in and did an EKG. They had a laptop computer right here, and I saw the printout come out right out of the computer that told me that my heart was in good condition. So I had the blood work done first, followed by an EKG. And then several of the nurses would come in and out, check on me. Dr. Cervantes himself came by as well and told me what time my surgery would be and chatted with me and took the infamous picture that you've probably seen on Facebook. And I mean, again, it was just so nice because he's so kind, and he really puts you at ease so that you know it's going to be okay. And this is all on the first day, and shortly after that, I had my surgery in the afternoon. The last time I remember seeing the clock, it was about 4:10. I was taken downstairs to where they do the surgery, and Dr. Cervantes had just finished up another surgery, and he came and chatted with me while I was lying on the bed ready to go into surgery. And we just chatted about other things, really. So again, it just really made me feel at ease. I didn't have any time to think about that I was going to actually have a surgery. So I went into surgery and I was out like that. And before I knew it, there were people standing over me saying, Amy, it's time to wake up. And when I woke up, I remember that I didn't feel any discomfort at all. there were just people telling me it was time to, move to the rolling bed when they would take me back up to the room. And I was told ahead of time that the surgery would be about 45 minutes and that I would be in recovery for probably a couple of hours afterwards. So from the time I left my room until the time I got back up to my room, I was probably gone 2 hours and 45 minutes to 3 hours. And once I got back up to my room, my caregiver was there the whole time waiting for me. She was watching TV. They have flat screen TV in the room with all kinds of channels and movies, and people were coming in and out as well. And I know that they were taking care of my friend Jill, not just me, the patient. And so when I got upstairs after surgery, I was brought ice chips to suck on, and just a whole parade of caregivers would come in and out of my room from about 7 p.m. that night, all through the night, taking vitals, changing my IV bag, making sure that I stay hydrated. They gave me in the IV lead injections into the lead that were antibiotics and painkillers. Never once did I feel pain. Never once did I feel any kind of anxiety. Oh, they also gave me liquid so I wouldn't be nauseous. And so I never felt nauseous. And so that was my first day. The first 24 hours is people looking after me. And then on the second day, I woke up and I made sure that I walked. That is so, so important. In fact, I forgot to tell you that I walked the night before a lot. It wasn't until about 10 o'clock, but that's when I got up and I walked up and down the hallway for about a half hour. And that helps to get the air and the gas that's in your stomach up and out of your system, because quite honestly, the gas is more painful than anything else from the surgery. So that's important. The next day I got up, I walked again, and then somebody came for me and took me downstairs, and I had a leak test where you drink this fluid and you lie on a bed and they do an x-ray of your body to make sure that your stomach is sealed tightly. And everyone in my group passed that with flying colors. So then we went back up to our rooms, and I had the rest of the afternoon free. I was brought Gatorade, apple juice, and as much water as I wanted. And I just rested the whole day. Again, when people came in and out and took vitals, took my temperature, took my blood pressure, and that's all I did was just rest. And I could tell as every hour went by, I was feeling better and better and better and more comfortable. And then what was my third day, which is today, if you can believe that. Again, I woke up this morning by folks taking vitals, and someone came in and told me what the plan was for the day. I went in and I showered, and when I came out, the nurses came and changed the dressing on my wounds, which, could you believe, they're like this wide. And I got dressed, and I waited until time to check out of the hospital. And Omar, my driver, came by, and he came with, I think it was Omar, that came with a package of antibiotics and antibiotics and other medications. And they explained to me exactly, and it's written down on a piece of paper, what I need to take, when I need to take it. And these are things to, there were things for pain if I have it. There were pills for, like I said, antibiotics to help fight off infection. There's a liquid that they gave me that will help coat my stomach so that the meds won't make my stomach upset. And then after that, I put those things in my suitcase, and Omar, our driver, came to get us, and my caretaker and I and one of the other gals that had surgery, we all went in the van, and we were brought to this is our hotel, which is really, really nice. We were brought to the hotel and we were checked in here. And then after that, we got to go on a little touristic visit of Tijuana. And we were brought to a restaurant called La Placita.